So this is the examinations that are performed during the carpal tunnel syndrome. So first would be inspection. So we will check if the patient presents with a band. So that is an indication that the patient has a median nerve impairment. And then next will be palpation. So for palpation, we just palpate the patient, the hand of the patient, the forearm of the patient, the finger, and then we check if flinch is patient or diagrammes. And then next would be musculoskeletal assessment. So for this one, this will be performing the FMT and then the range of motion. So for MMT is we'll ask the patient to flex the wrist. And so flexing the wrist, okay, we will be applying minimal, moderate to maximum resistance. So to check capability of the patient. Okay, so I want you to bend your wrist and then I'll be applying resistance. Okay, one, two, three, go. Okay, very good. And then next would be extension. So same rehab procedure, and then I'll be applying resistance. Okay, one, two, three, go. Okay, very good. So next we'll be performing the range of motion. So we'll be using the goniometer to assess for the range of motion of the patient. So positioning will be 90 degrees abducted, and then okay. So i-flex mong hand, i-bend mong hand towards ground. Okay. Okay, very good. Okay, the next is extension. So balloon sa taas. Okay, one, two, three, go. Okay, very good. So that will be for the range of motion. Next will be neurological assessment. So we'll be checking for the sensation of the patient. So in here we'll be using the sharpened end of the reflex hammer and then the dull end of the reflex hammer. So this to check for the pain sensation and then if maka-feel siya sa dull sensation as well. Okay. So I have here the sharpened end of my reflex hammer and then ako rin siyang i-prick sa imong skin. So inana na ang feeling niya. Okay. Now I want you to close your eyes and then tell me if you feel the sensation. Okay, close your eyes. Okay, can you feel this? Feel this? Okay, this one. Okay. Next will be the dull end. Okay, so can you feel this? Close your eyes, please. Okay, feel this. This one. This one. Okay, very good. So that will be for neurological assessment. Now for coordination assessment, we just ask the patient to perform non-equilibrium exercises for activities. Now this will be just due to the impairment will just be due to the pain and numbness of the patient, but not specifically basal ganglia or a cerebral affectation. And the next will be functional assessment. So we'll be performing it sa according to the athlete. So typically for CTS patient, they have difficulty in dressing, upper dressing and LE dressing, and then eating, and then personal hygiene. And then for special tests, we'll be performing the Valentine. So for Valentine, okay, i-bend lang mo yung arm, and then mo siyang i-meet together, and then just do this. Okay? Okay, very good. So that will be for Valentine, for special tests. And then we can also perform other special tests such as Carpal comprehension test and Nielsen. Now for the outcome measures, okay, we have the Boston Carpal Tunnel Questionnaire and the Disability of Hand and Shoulder Questionnaires. So those are the examinations and results that we typically perform in a CTS patient. So for the plan of care for CTS patient, first would be patient education. So for this one, we'll just educate the patient the cause of CTS, the triggers, and also instructions in modifying symptoms, provoking wrist movements. And then second will be application of a static wrist orthosis at night to reduce the comprehension in the carpal tunnel. So this is application of our static wrist orthosis and then use lang niya when resting or sleeping at night. And then next will be the median nerve mobilization stretch to help mobility of the median nerve. So we'll be performing this for 8 repetitions, 2 seconds holds, and for 3 sets. So for median nerve mobilization, okay, i-straight lang yung hand sa imong side, and then imong i-point towards the ground, imong fingers or imong wrist, And then with that, kay imong i-bend imong i-rotate imong neck towards the other side, and then mo look down ka. And then imo na i-do simultaneously. So I like this. That, and then look mo towards the other side, kay mo i-bend towards your shoulder. Okay? So let's perform it. Like that. So that will be for the median nerve mobilization. So 8 reps, 2-second hold, and then 3 sets. Now for the tendon gliding exercises, so this is to improve mobility and prevent increase of swelling. So first, for tendon gliding, kay ang atong first buhaton will be the what we call the docking. So like that. Okay, so that will be the first, and then ang next is we perform follow lang ang movement. So your fingers, you may touch here. Okay, and then you may touch your elbows na sa move lang mo downwards, and then bend kamay. Okay, very good. Again. Okay, very good. And then next would be the full fist. So more ako fist ng hand. Okay, again. Very good. So that would be for tendon gliding exercises. Now for progressive strengthening exercises, so this is to help the wrist and fingers with application of light weights to improve the muscle strength. So for wrist flexion and extension, we'll be performing 10 repetitions for 3 sets. So for here, I will be using a lightweight dumbbell. So imaginary lightweight dumbbell lang sa. So okay, so imagine nag-hold ka og weights. Okay, and then i-flex or i-bend imong hand towards here. Okay, very good. Again. Okay, very good. And then next is for extension. So balita. So nag-hold gyapon kag imaginary dumbbell, and then nasa imong hand. Okay, so we perform this for 10 repetitions and 3 sets. Next would be a squeeze ball. So we have your squeeze ball. So after hold the patient, ipag-grasp lang nato niya, and then squeeze. Okay, 1, 2, 3, go. So we'll perform this for 10 repetitions, and then with 3 seconds hold, and for 3 sets as well. Okay, very good. Next would be hand coordination and fine motor exercises to improve the use of thinner muscles. So first would be reach, grasp, and release. So here, I want you to reach for the ball, hold it, and then transfer to the other side. Okay, 1, 2, 3, go. Grasp, and then put on the other side. Okay, very good. So that will be for the first exercise. And then for the next hand coordination fine motor exercise is pump to pump. So like this. So imong thumb, i-touch lang mo to your second finger, and then balik instead, here, here, here. Okay, very good. Lang. So we'll be performing that for at least 10 times, and then 3 sets. And then lastly, we'll be performing a task-specific exercises for patient's lifestyle to improve functional independence. So as my patient is a student, so ato ipa-type lang si patient sa keyboard, and then I will give her a pencil, and ato ipa-write. So that is for task-specific exercises. So that will be all for the POC for the CTS patient.